Hello, my name is Dr. Virginia von Schaefer. A question that's often asked of me when patients are considering how to go about getting their cancer treated, there are questions that come up because of the different ways of administering chemotherapy. And I think it's important to kind of compare and contrast what they are. Traditional chemotherapy, we know, is given in a set of regimens, set of drugs based on statistical success in basically proscribed amounts that are determined by your body size, your BMI, body mass index, or your kidney function if drugs are excreted through the kidneys. And that's pretty much it. It's a standard regimen, and everybody's going to get recommended those standard treatments, whether they're IV and or oral. Okay? Now, many patients have expressed concern about the amount of drug that's administered because it's once every 3 weeks, and it's a very kind of traumatizing experience. You get a lot of poison on one day, and it takes you about 2 weeks to recover. You have 1 more week to feel decent, and then you're going to go back and get another dose of it. So many patients are concerned about that, especially if they're elderly, and they're looking for something else. Now, both traditional oncologists and integrative oncologists have come up with the designation of metronomic chemotherapy. What does that mean? They're just taking the standard treatment and dose of the drug, dividing it by 3, and administering a lower dose on a weekly basis. And this can be helpful to patients, and it may help them tolerate it more, but it still does not address underlying factors that might have predisposed the person to developing the cancer, and it does not address enhancing the immune system function. So in my practice, I developed something I kind of call the combo platter approach, because it involves identifying the underlying entities that may be helping to cause or perpetuate the cancer, such as viruses, bacteria, parasites, whatever, but then also identifying resistance factors and creating a drug treatment regimen that is personalized to an individual's cancer cells and their susceptibility to all the known drug treatments, whether it's chemotherapy agents, immunotherapy agents, or small molecular weight molecules and oral agents, as well as natural agents, which involve things that people traditionally talk about, like vitamin C or artesunate, or any one of many number of things that are specialized or promoted by a quote-unquote integrative or alternative. The unique thing that I like to try and do is support the immune system and boost the immune system function and cut the inflammation. Because when you kill a lot of cells at once, you cause a lot of inflammation and a huge burden on the immune system. And none of these other techniques, neither traditional or metronomic, really address those issues. So I have found over the years that boosting the immune system, or potentiating it, along with giving the chemotherapy agents and perhaps other techniques as well, in synergy and combination, creates a better and long-lasting result. Thank you.